Hello, sir. How are you? I am a first-year medical student. I am currently enrolled in a patient-centered medicine course. May I conduct your medical history and physical exam? Hi. Yes. You may. Great. So what brings you in today? I was feeling some shortness of breath this morning when I awoke. While getting ready for work, I developed some chest pain and dizziness which has progressively worsened over the past 4 hours and is now crushing pressure on my sternum that is radiating up my right arm and neck area. It is very intense, like an elephant sitting on my chest. The pain is quite severe. I have also begun to sweat profusely. Can you tell me more about that? What? Can you tell me more about that? I have acute mid-sternal chest pain. It is severe. Could you quantify the pain for me on a scale of, it is a 10 out of 10. Okay, I see. And do you have any history of medical problems? Yes. I have diabetes, hypertension, obesity, atrial fibrillation, hypercholesterolemia, and a history of ischemic heart disease. 5 years ago I had 2 coronary stents put in. Can you tell me more about that? I had 2 stents placed in my coronary arteries. This was to restore their patency to ensure my heart muscle can be perfused with oxygenated blood to prevent it from becoming hypoxic and dying. I see. Do you take any over-the-counter medications, homeopathic remedies, herbal supplements, illegal street or recreational drugs, or use tobacco? Yes, 2 packs per day for 30 years. I am in a lot of pain. We have some smoking cessation pamphlets. Perhaps you would like one. Do you have any family history of medical conditions? Yes, my father had a massive heart attack and died at age 47. Both of my younger siblings, who are in their 40s, have been diagnosed with coronary artery disease. Can you tell me more about that? Why do you keep asking me that? I'm asking open-ended questions so as to avoid influencing your responses and to glean additional information from you. It is part of taking a thorough medical history. We learned it in our patient-centered medicine course. What is your family life like at home? I lead a sedentary lifestyle. It is unremarkable. Have you ever been hospitalized? Yes, when I had 2 stents placed in my coronary arteries. With what ethnicity would you say you most closely identify? I am in acute chest pain. It is severe. I'm sorry to hear that you are in pain, sir. But first we must conduct a thorough medical history. Most diagnoses are made from the history. We learned how to take one in PCM. Sir, I see that you are having trouble breathing. Yes, I am short of breath. Secondary to my acute mid-sternal radiating and crushing chest pain, that must be frustrating. Next I will perform a full musculoskeletal exam which will assess your brachial and patellar tendon reflexes. Please let me know if you feel any discomfort or pain. Medical student, please go and tell your superior that I am having an ST elevated myocardial infarction and need to be taken to the cardiac catheterization laboratory for emergency percutaneous coronary intervention. You mentioned earlier you had diabetes,